So welcome this evening to the Windmill practice. We've got a live stream presentation. Thank you for those who've logged on and want to know a bit more about the changes that have happened at the Windmill recently. You probably know me, I'm Dr. Sperry. I've been here 20 years and really enjoy working in Snenton. I know many of you. We've also got BJ here from Modality, which is the larger group practice working across the UK, who has very helpfully come to support our practice at a time when we weren't sure we could continue. So because of this transition to a bigger group, we just thought it'd be a really good opportunity to explain that a bit to our patients and anybody else in the community who's interested. This live stream will stay on our website, so anyone can look at it later if your family or friends would like to look. So BJ, without any further ado, welcome to the Windmill. Thank you for coming up to Nottingham, and you've already done a huge amount of work to help us adapt. So thank you, and thank you for your presentation.
Thank you very much. Thank you very much for such a warm intro. So good evening, everyone. Very nice to meet you all online. I'll run through a few slides and talk through what the plans are, where Modality Nottingham or Modality Windmill is going, and who we are as Modality, who we are as a partnership. So let's run through some of the slides, and happy to take any questions, although it's only starts out here, so we'll take. So this is our Windmill practice, and I think the one thing that I was quite struck is the partners or the doctors that are there, the name board hasn't changed because nobody has changed. We still have all of them with us. So it's an exciting change, because change normally brings changes within members of staff or management team or the doctors. And it's a credit that none of that has happened, and we still are continuing as we are. Okay, and this is an intro slide about some housekeeping. They will be talking a little bit about the practice history, a little bit about Modality, the new partnership that has taken over or who's now providing the service. We are going to request, we will have a request for you to join our PPG and have your voice heard, be a part of the changes that we are going to commit to in the future. And we also will talk about new developments, and if there are any questions, we can take them. So the poster next to it was a slide that we really, the poster that we created to invite you. So just got it there for a reminder. So if you're online, thank you for joining us. Okay, this practice has got a phenomenal history since 1988. With 1,700 patients, now it has grown and grown and grown, and serving 11,000 people in this community. And I think looking at the history and looking at what the practice is doing, it has been a phenomenal support to the community here. And it's a credit to the doctors and the staff here and everyone who had worked in the past. So it is a fantastic legacy for us to have taken over. It is a training practice, teaching practice. We train medical students. We take on doctors in training to make them GPs in the future. And we have nurses training. So it's a phenomenal legacy that we have taken over. Yeah, we got the next slide then. It is a very good skill mix. The non-English speaking patients are about 6%, and the top 5 are Polish, Urdu speaking, Arabic, Bengalis, chairs. But it is actually quite different to even the practice next door, because the population seems to be very varied in there. So it is kind of different, but it's predominantly English-speaking population we've got here. Okay, so I think quite often wherever we go, the thing that we hear about is the receptionists haven't got time for us. They are very busy. The phone calls are quieter. So what we did do was a day in the life of new receptionists. What do? or how busy they are. Pretty much other than a little bit of a comfort break, right from the time they say hello, they literally go on to do task after task after task after task after task till the reception closes. So it's quite a tight, packed workload. Although the doctors sit there, spend 10, 15 minutes with each patient, nurses spend 10 to 30 minutes with a patient, the staff really churn the numbers, take the number of phone calls, make people to come to see the doctors. So huge credit to how busy their life is and the day is and how busy it can be. So for us, it's a huge respect to any reception admin staff for all the work they do. Okay, so this is slightly out of date. It was meant to be from January to June. We just looked at what is the practice done, what has Windmill done in the last 6 months when we looked at in June. We catered for 690 shy of minor illnesses. We did about 2,000 blood tests. We had 1,750 nurse appointments. And we also have a healthcare assistants about shy of 400. So these are huge, huge numbers. We had 950 people or more joined our practice, and we had 700. That shows the number of people joining and leaving the practice. Any city practice, the turnover is quite a bit. And when there's turnover, there is also the amount of work that goes in with it. Some of the specialties that doesn't happen everywhere else is the drug clinic appointments, 250, 65, 35 minor surgeries, nearly 50 coils we fitted, thousands of admin processes, thousands and thousands. Had a lot of phone calls and 4,500 GP appointments. Phenomenal, incredible amount of work that you individual patients may or may not see. We have processed nearly 15,000 hospital letters regarding our patients, the amount of workload that we have created. So it's very important to know what happens in the background when the GP is not seeing a person, or when the nurse is not dealing with people sat in front of them. Okay. So I said people have remained the same. So what is the change? Why are we having this engagement session? Whose modality? What happened to my doctors? I know Dr. Perry. We want her. We don't want you. That's a very valid point. So just it'll be helpful to have a little bit background about modality. Who are we as an organization? And what do we do? So modality is very similar to what Windmill as a practice is, only that it is about 450 times larger. So we serve a population, Windmill serves a population of 11,000 patients. We serve a population of 470, 480,000 patient population. We are spread across the country. There are 8 different regions. Nottingham is our baby division, because we came live in Nottingham in January. So we really, anyone who want to join us, any GP practice who want to join us, we go through a mutual assessment of, we go and check them out, they come and check us out, and ultimately our values are very much care. That is commitment, accountability, respect for each other, respecting colleagues who we work with, and excellence in anything we do, really. We want to be excellent in patient care. We want to be excellent in the way we treat our staff. We want to be excellent in innovation or bringing new things to you. So that is what modality stands for. That's what care stands for. And hopefully, that's what you will be seeing from us throughout the next 10 years that we are serving the local population. So our vision is being a leader in delivering community-based care, literally anything in general practice or providing outpatient clinics or whatever services we provide to improve population health across the system. So we are committed to improving care across the system. That is pretty much our vision. And that's why we all remain and we all get up and do the jobs. And that's why, that's a compelling vision that we have got for us to deliver the patient care that we want to deliver. As I said, we have grown over the time to serving quite a lot of people. Although our truly registered population is about 480, through our PCNs and through our other community work we do, we really nearly cater for nearly 8.5 million patients because we have a huge unit community, the outpatient unit in Birmingham that caters for whole of Birmingham. So we really come in contact with nearly 8.5 million patients that we can serve, we serve during any one time. And as you can see, our services kept increasing over the time and we keep becoming wider. Yep. So everyone suddenly think, oh my God, this is a monstrous beast. It must be a machine. At the end of the day, we literally are people. We just are human beings. That's me in my community, just reaching out and going a community event. So we literally are human beings serving, doing the best for our community. As you can see, that's our COVID pop-up clinic when we reached out to give the vaccination. And this is people having a knitting. We do quite a lot of events with our patients. This is people sitting in the waiting room doing some knitting with our patients. So we are very heavily involved with our patients, community, and also we get various other ways of engaging with our patients, including some Tai Chi lessons. All happens in Yorkshire, don't ask me why, but everything happens in Yorkshire. So we engage with our communities in a very, very different way. Within Surrey, within Yorkshire, our reach is not just seeing patients in and out and walking out, but we also want to be a part and parcel of the community that we serve. And you will hear a lot, and you will see a lot more of it in the future. Very proud. Pretty much most of our people say they are very happy working with us. But you can see, we are not perfect. We do have work to do. For whatever reason, there could be some people that are really not happy, or we need. This shows that people are able to talk to us and we are able to make those changes. And our patient satisfaction like this runs throughout. And you can see here on top, we've got nearly 1,232 staff that we employ. And our response rate is nearly 75%. 75% of our staff answered the survey. It is phenomenal. Surveys are really not answered to this high level by anywhere. In East Surrey, pretty much 100% of staff answered the survey. The one other place is in Wellsprings. Nearly all the staff answered the survey. Really, well done to Wellsprings. So I'm hoping Nottingham will be all green when it happens next time. Let's wait and see. So this is just a slide to show we listen, but we create a very high-performing team. Only by listening we can do it. Probably something very important for people in Nottingham or people in this part of Nottingham to know. The modality in Nottingham is Windmill and Wellsprings, the two practices, which is less than a mile away from each other. And because of the vicinity of the two practices, you will see very much closer working. We take all the good things that's happening here, we can do it in the next practice. And we take all the good things that's happening there and bring it here. We are doing quite a lot of background work to make sure that we together build a very resilient team and our whole aim is to serve the collective population better. Both practices still work very independently, but we do things joined up as well in the future. There's a lot of things that we are doing that we'll be doing joined up work in the future. So something very important. Every year, the country does a population or patient satisfaction survey. The national team writes to every odd selected group of patients. It's meant to be 3% or something, roughly about 350, 400 patients they write to, and they ask for how are we as a practice performing? How does Windmill perform? How does the doctors at Windmill? What is the organization like? And how do you rate the experience, overall experience? So our survey results is 122 people of the nearly 500 survey that was sent out. Only 122 people responded to the survey. So the uptake is 25%, which is quite poor, but it's no different. Across the country, it's very variable, the uptake of the survey, and it is nothing really to say that Nottingham is any worse than anywhere else. It is exactly similar. If you go to the next slide, so our overall experience said about 65% people were happy or very happy with what experience they had from the service. Something for us to reflect that we need to listen to you a lot more. Something for people to understand. Some of the changes that happen because we had COVID in the last 3 years. We had challenges of recruitment. We had challenges of meeting the demands of the population. The expectation has gone up very different, and we are struggling, are continuously working harder and change way to meet the demands of our expectations. So that's what the overall experience is showing. Let's see what happens in the next slide, and then we can put in some of the actions. So what we heard from the survey when we looked through the details is you said we can't get through the phone. We listened to that. We know the telephones have been a problem, and we are changing the telephone system. We are going to a telephone system, which is a digital telephone system, that's what we'll be going in the next few months. They take a working time of 2-3 months before they can install all the. So we already signed the contract, and we are waiting for the new digital telephone system, which is quite smart to be coming in. So hopefully that will happen. So then they said, I can't see a doctor, but I want to see a doctor. So we are thinking we need to change the model of care. We need to try and make it feasible for people to be able to, A, book those appointments, whether it is digital access, whether it's non-digital access. We also need to be able to just make the right kind of people seeing the right kind of, not everybody needs a doctor, but there is a cohort of people that's always going to need to see a doctor. So we just need to get the right people into the right thing. So we need to do a lot more work from that. There never is enough appointments. So we had recruitment problem, we did have, and thanks to the management team and the doctors here, we have now recruited and we are fully staffed at the moment, albeit all but one maybe reception staff missing. We pretty much have worked exceptionally hard to get that. It is unusual. We still have maintained our highest number of nursing team, and we continue to have them. So not every area struggle, but we had struggled with recruitment, which is the norm for NHS across primary care, across any general practice, whether you're in Surrey, whether you're in Birmingham, whether you're in Mid Sussex. Some parts struggle more than others. City practices always had the problem. And London, you don't need to say that. Everywhere there is pockets of places that struggles. The more city, the more difficulty is because the population is ever so changing and the demands are different. But we have recruited, and we are really good with the recruitment at the moment. I just want to highlight one thing. There's a lot of conversation that people might be hearing that GPs are going on strike. There is something collective action that's going to happen. From our point, from our commitment, is we as GPs take pride in one thing, that is being beside our patients, working for our patients, being with our patients. And whatever you hear, whatever collective action collectively we decide, we will risk manage every one of them, and we will be doing only that is safe or minimal impact that will cause, so that we are giving a clear message to our system, but we are also making sure that we don't harm our patients, because that will be against all our ethos, that one. So we said about the national survey. So this is what we are committing to. Based on the national survey that you have said, we have created an action plan. The action plan is, we definitely know, that every area that you have commented on needs improvement. We would commit to changing our telephone system by the time we do the next national survey. Our recruitment is already now to the maximum. We need to absolutely retain those staff. We need to make a happy working environment, atmosphere for our staff. We commit to working alongside the Wellsprings and try and see if there is a digital system or digital way of booking appointments that will make those access to GP practice better. We are learning continuously from the two practices to make sure that we make your ability to book those appointments better. So hopefully that's our next journey. That is pretty much what happens in Windmill. What are the new things that we bring as an organization that no other people can bring other than modality as a partnership? What can we bring? We are committed to lifestyle medicine, and we don't get paid for lifestyle medicine, not everywhere. But what happens in Nottingham, we are committing to bringing lifestyle medicines, lifestyle management, or lifestyle way of managing one tsunami that's hitting us at the moment, that is diabetes. When you think about diabetes is really increasing in numbers, and pretty much there's a number of people who are diabetic who don't even know they are diabetic, or if they are diabetic, they are so poorly managed. So as an organization, we have taken pride in investing time, energy, and everything else to find out how we can support our patients to do diabetes better. And we commit to getting diabetes through local GPs to come and reach out patients in group consultation, inviting them, and then supporting them for a period of 6 months with the health coaches. So this is our commitment, our future, our innovation to our local population, both in Windmill and Wellsprings. So again, Dr. Virpan Badraj, he is a GP, he is a lifestyles guru. He has written so many papers, he's been involved in that. We are highly commended awards we have received from HSJ. He will be the person who will be coaching the people locally to provide the service, and it'll be a group consultation where 20, 25, 30 people, how many ever sign up to it, will come. They continue to get all the one-to-one appointments they get for the nurses or the GPs. This is an additional support, and we will continue to support those people who get engaged in this program through our health coaches. How many ever text message you want to text them, you can do. And we are here, not just for diabetes, but a number of other programs, but this is a bespoke program for solving what is a real crisis that's hitting our country very soon. So you might want to hear, okay, you're providing this. Have you got anything to say that's working? Literally, you can see 100% of people who attended the program are exceptionally satisfied with what support they have had. 85% of them reported they've reduced the medication for diabetes. So the diabetes improved so much so 85% had some kind of reduction in medication. When we talk about medication, it's not just diabetes medication, it can be even blood pressure medication. Because people lose weight, their blood pressure goes down, the diabetes improves, as well as hypertension improves. The risk of getting heart disease is reduced. 10% reduction in the body weight. We all like to be role models, don't we? So that again is a gift that we are going to do for our patients in modality Windmill and Wellsprings. It does sound like I'm saying we've got it all sorted, everything is perfect, there's nothing more to learn. No, far from it. Modality as an organization, we just learn continuously. There is a learning step every day. We just want to be successful. We will continue this process until we all hopefully reach the promised land. But the promised land is only the promised land when we all have reached the 100% satisfaction survey, when we have eradicated the diabetes, which is never going to happen. So the continuous momentum of us changing for the best will continue to happen. So my last slide. Thank you for the time you've taken to watch this video or just look at it or review it. We as an organization are really delighted that Windmill is a part of our organization because the ethos, the legacy, the doctors, the partners have left is very much closer to the heart of us own as an organization. And Wellsprings being just less than a mile away, it just creates the comfort that two practices can work hand in glove. We have Dr. Sain, who's working in other practices, who's a partner. He is supporting both the practices and he will be supported by all the doctors. And more than anything, I think the four partners who were the partners here still remains here as a partner. And they are supporting me personally, but also every staff when I'm remotely there in a phenomenal way. We've got the managers, him who's done a phenomenal job of supporting the staff. The transition is a hard thing, and everyone has contributed that one day the Windmill practice is there, run by four partners. The next day, modality is running that, and there is no difference between what happens. Because believe it or not, we are one organization which is branded NHS, and we just continue to be. And that's the pride we take. And thank you for that. I would mention, if any one of you want to be a part of our patient group, patient participation group, if you want your voices heard, if you're really satisfied with what we're doing, if you're really a follower of some of the GPs who are here and you want to contribute to us, or you're really not satisfied and you want to be a part of us, changing the way we deliver service, whatever part you want to play, we want you to come and be a part of us and part of our patient group and work with us in a way that we can deliver the service that will meet the needs of everyone we cater for, 11,000 patients. And hopefully I'll see you in the future with more positive news and more things that we bring to Nottingham. Thank you. Any questions at all online? Is there anything that you can ask? Okay. That's, yeah, certainly. Yeah, in the room, Health Watch. Yeah, absolutely. Delighted to have you here, by the way.
Thank you, Vijay. So it's Kinsey Clark from Health Watch Nottingham and Nottinghamshire, and that was really very interesting to hear and pretty comprehensive. So I think you have covered a significant number of the issues or the concerns we had in mind as a partner in Health Watch in Nottingham. Two things I really wanted to, one, maybe more of a comment than a question, but one of the things I noted, you said there were nearly 1,000 new patients joined the practice since the last 6 months from January, which is a lot higher than we would have expected. And my question or kind of thinking is, how is the continued growth of the new patients is being continually absorbed and managed and integrated into the transition, as well as the constraints and the continuous other issues that the practice is dealing with, because I guess there's no infinite end of capacity. So I'm just a little bit mindful of, I don't think there are new GP practices being recruited into the practice, but the patient population seems to be continually growing.
Correct. I think the 10% is not just the increase. So the 1,000 patients, nearly 1,000 patients joined us. The very next bullet point was 700 also left. So there is that, yes, the number is increasing, but it's increasing slowly, and it's the case for everywhere. The change is very normal for any city. So here it is 10%. My practice, which is in Surrey, is very next to the Gatwick Airport. My changeover is 15%. So 15% of my population keeps changing every year. So it is a difficult one. The transitioning is because students come to city to study, and it could be, people come to work here. So the amount of work that we need to do is different. I think the way we are serving is when people come, we need to quickly register them, make sure all their medical records are up to date, make sure the repeat medications are answered appropriately. But the most important thing is we just need to make sure that we make our patients aware of all the services that's available locally. And that can only be achieved by staff functioning to the maximum level. Our reception team should be very experienced. Our GP should be very experienced. We should have an experienced manager. And all those things need to support, underpin our success. It is challenging, I would say, but the challenge is not unique to Windmill or to Wellsprings or to Modality. This is the challenge that any city practice is going to have. It is a challenge that any affluent areas are having, or deprived areas, to be fair. The unusual thing is we also run the drug clinic here. So the population, although it's a city population, it's also quite mixed and quite deprived as well. So we do have a very different population, but registration, the numbers going up is very much within our manageable limits. We did look at our clinical mapping, that is looking at the doctor-patient ratio, and we are fine with that. We still have, and we do have capacity to recruit other people because our recruitment have done well, our retention have done well, so we are okay. And if we need, for every safe number of patients, we need to have clinicians to provide care. We will need to look at it regularly. That will be the job of the management. Looking at it, I'll be working with practice manager here just to make sure, and the doctors here and the staff to constantly listen and understand what's going on. Number of factors will affect. It is the appointment demand. Is it the different way of producing appointment? Is it actually lack of GPs? There are some parts of the country where you can't recruit GPs with enough money. This is quite different. We are having a very different issue here than otherwise. But it's a fantastic question, and I would only expect Health Watch to ask that question, really.
Thank you very much, and I will ask you one more.
Yes, sure.
So for us in Health Watch, we're about the independent public and patient champion, and we are particularly always kind of checking that the most deprived, vulnerable, disadvantaged, marginalized 15% of the population of any practice are not being left behind. And Windmill practice is actually a very model practice. It has got a very good reputation in Nottingham. So we do hope that the new takeover by modality will only enhance that. But one of the reasons why it had a unique offer is because it used to cater for very particular patient groups: homeless people, substance misuse, refugees and asylum seekers, people with the communication and complex issues. Can you reassure us and the patients and the people who might be, hopefully will have access to this, that in modality there would be no negative impact on those particularly hard to support and hard to reach section of the population of this practice?
You packed in quite a bit in that question. So, like throughout my conversation, I said, it's a huge credit to my partners who has been here before. And I'm going to ask you to come and support me on this question as well. So, Gary, you might well come. You need to give me your version as well. So, I think you're absolutely right. They have left a real good legacy, a legacy that we just really need to follow. We're not starting from a bad place. We are starting from a really good place. The practice being popular with the patients, serving the homeless people, and serving the people with abuse or anything else, substance misuse or anything else. My first, from a modality point of view, I'm the highest level of what do you call it, the executive partner, executive team that we can have to support. Each one of our groups have got an executive partner. So I am the executive partner at the moment, looking after Nottingham as well as my own East Surrey. One of the commitments that I made to the 4 partners then and now is I don't want anything to change, because the way that you guys have done is a compassionate care. It may not have been a profitable care, but it's a very compassionate care. You have looked after what is most meaningful to us, that is the substance misuse, the homeless population, the deprived population, serving the community in a very different way, putting all our strengths on education and focusing on leaving a legacy. That's what I said 3 months ago. 3 months is good enough time for me to have done a financial assessment and make sure, that's what I said before, we are changing the direction of travel. As an organization, until this day, there is no plans to change any of the services. And we have had conversations, if anything, how can we support the community better? What else we need to do in order for us to serve the community better has been our conversation with all the services. We also look after the secure unit of people with severe mental illness, and exactly the same conversation we are having there. How can we do things better, not how we cut corners? Helen, what do you think?
The one thing I would say is that Michael Varnum and Margaret Abbott set up this practice with a really strong ethos of, we are here to serve vulnerable people. That was their whole raison d'etre, the reason they were GPs. And of course, they've recruited and attracted people that want to work in this environment and who share that ethos. So the 4 partners very much are people who were attracted to work here because that's what we want to do. We weren't people who want to make a big profit, work somewhere where we would make a lot of money. We wanted to work here. And we've continued to recruit those people. So whether partner or salaried, everyone who works here, GP, nurse, they get it. They're here because they find it rewarding, they find it interesting, it's medically interesting, it's socially interesting. And so the team has not changed. And the team has a really strong connection with this community. We feel really strongly. We have good connections with local voluntary services. We have chaplains coming in to support patients from our local church community. We just have connections that we are really keen to promote and increase. And I don't think that will change because the people haven't changed and the reason we're here hasn't changed. I don't see that changing actually, because you attract people who share your values and the values will stay the same, I'm confident.
Well, I'd echo that. So I'm Dr. St. Gandhi. I'm one of the GP partners at Wellspring Surgery as part of Modality Nottingham. And as we mentioned, you know, Modality Nottingham is now 2 sites, and we work very closely together, increasingly so over the past few months, and hopefully even closer as we move forward. I think I echo everything that Helen and DJ have said. One of the things hopefully the patients have seen is virtually no difference whatsoever. And that in itself is a massive thing, to go through such a transition and still have the same people looking after you, same service, the same experience. That in itself is so hard to do at such a transition. But actually what we hopefully will see in the future is enhancement of that, not change in the negative. But I guess if you want a way to make sure that happens, I guess the thing I would ask from yourself and also to those people hopefully watching this is tell us where we're getting it right. You know, one of the things the missing part we have is we don't have the patients coming to us and telling us where we're doing well and where we need to improve. And actually, that's the part I think, you know, hopefully this event will help us start to do that. We can get that patient voice. Now, the individual patient voice we get, every practice gets day in, day out at the reception desk, and that's powerful. But what's more powerful is that combined voice, the patient participation group, the group itself coming through and not only telling the practice what we're doing right and what we can improve on, more importantly, helping to shape. And one of the reasons why I was asked to come today, because at Wellspring Surgery, we have that voice already, and we're keen to foster a similar voice here at Windmill, so that actually we can hear that message in both areas in terms of what we're doing for Modality.
And to be fair, we have always struggled. We've tried so many times to relaunch a patient group and always struggled to do that. So it'd be really helpful to have a bit of guidance on that and how you've successfully managed that in a very similar population to ours.
Well, hopefully we'll see. And I guess for those who are watching this, fingers crossed there are still people watching this at this point. Like we said, tell us what we can do. Come to us and join a participation group. That's what we call it because that's what the standard name is. And that's the important one, is to participate in the practice, to help drive forward that change. In a sense, hold us to account, but also make it so we look better.
Thank you. Good to hear you.
Thank you very much. Good night. Thank you all for watching.